Well, there's evidence that's increasing that, in fact, Delta is for sure more contagious and probably more virulent, and will be is causing more severe diseases and may have a long-term impact that will affect children for many years to come. Not a significant number, perhaps 1 to 5%, but for that child, it's significant, and for that family, it can be devastating. This is a disease that is impacting children, and we need to stop it right now.
You just said, and I've heard you say before, this virus could impact children for the rest of their lives. That's really alarming, and I haven't seen the data on that. Why do you say that?
Well, the data is accumulating as we speak. First, we do know that, in fact, viruses can affect children into adulthood. We know what's happened with polio when we have the post-polio syndrome. But we're seeing changes in gray matter in the brain. We're seeing changes in the vascular of children. We're seeing MISC, the inflammatory disease of multiple organs. And so what we're seeing today is indicative of potential long-term effects on children. And we can't risk children's lives today because they're going to be having these potentially having significant impacts the rest of their lives.
You've suggested that parents shouldn't let their kids be in contact with adults who haven't been vaccinated at all. How's a parent supposed to do that? I mean, that's suggesting that they do something isn't that impossible?
No, it's actually very, very, very possible. First, they ought not to be taking their children anywhere where people aren't masked.
Like schools, because in Florida, they're not masked.
Absolutely.
So you're saying parents in Florida, 30 million people in Florida, no kids go to school?
I am saying that this now is not turned from a public health crisis into a political crisis, and parents need to be making the political decisions. And yes, that is a decision that parents can make. And in fact, it is a potentially very rational decision. This is a crisis that we're in, and crises demand courage and leadership. And it's very difficult for me to understand how and why a parent would, in fact, potentially risk the life of their children by putting them into an environment which we know could harm them and potentially kill them. I know that's a radical statement.
It is.
But these are radical, this times we're in a crisis, and it demands a radical approach.
Of course, what we really need, doctor, is for more people to get vaccinated. I know, because every doctor and scientist I know says it. So shouldn't we be spending our efforts on trying to explain to people why they have to have the vaccine instead of listening to people like we just heard in Arkansas, who I guarantee you think that they're on the right path, but have been led astray by people who are feeding them full of BS?
Actually, I would go a step further. We know there are resistors for sure. We ought to be working with vaccine mandates.
How can you mandate a vaccine when we don't even have a promise from the government, in other words, from the Health and Human Services or anyone else, that this vaccine has full approval? It's not fully approved.
Well, we know the vaccine is effective. There have been hundreds of millions of people around the world that have been vaccinated. The lack of approval at this point in time is a bureaucratic issue, not a scientific issue.
A lot of parents and a lot of people who are watching tonight have said, if it's not approved, I'm not taking it. When it's approved, I'll think again. It's still not approved.
Well, we see the private sector stepping in at this point in time to mandate it for sure, and that is in fact a challenge that you suggest to the FDA to in fact move the licensing of these vaccines up quickly. At this point in time, it's primarily a bureaucratic issue and not a scientific issue that's resulting in the delay in licensing the vaccine. This is a crisis that we need to avert, and we can avert it. It's now turned into a political issue, a political crisis. It's not a public health crisis because we can address this virus quickly if we were allowed to use the tools that we know we have.
Dr. Goldhagen, you know, the one thing that I don't think we talk about not enough, and I get that from doctors with whom I have discussions. It's what happens with the next mutation, because we let this thing continue to spread by not getting everybody vaccinated, and the next mutation is resistant to the vaccine, and then we start all over. Do you see that as a possibility in our future?
Absolutely, 100%. And I've been quoted on saying that frequently. COVID-19 has been a dress rehearsal for the Delta variant, which should be called COVID-21. And we know what viruses do. The next virus, which is highly probable will be hitting us soon, potentially will be more contagious and more virulent. We had HIV and AIDS, right? We had SARS, we had MERS, we had Zika, we have Ebola. So this is nothing new. What will come next is what we should be concerned about. And if we can't, as a community, agree on something as simple as wearing masks, how can we even begin to think that we can address the challenges that will happen with the next virus?
Dr. Goldhagen, thank you. Shepard Smith here. Thanks for watching CNBC on YouTube.